I'm Terry Young and I'm the Professor of Healthcare Systems here at Brunel. I've been here for more than 10 years and I had a career in industry in the sort of broadband research and development area. Moved into healthcare, and my research since becoming an academic has been around the delivery of healthcare, the role of technology in healthcare delivery, the role of information technology, and the organisational elements of care delivery.
Why should people attend HC, do you think?
I think that the whole information piece around healthcare has been pretty undervalued for the last 10 or 20 years. And we've had lots and lots of starts and stops. And I think that the Health Informatics Congress has an important part to play in pulling different communities together around information, knowledge, and how it's used in healthcare. I think it's managed to connect up groups like the BCS and the elements of the NHS with some of the academic world and a lot of the industrial infrastructure. So I think it's played an important sort of nucleating role. I think the trade show is worth going around and seeing people at. And I think increasingly they're really seeking to sort of tease apart some of the information and knowledge puzzle, which is a hard one to tease apart, but I think they're important players in that space.
How are you involved, or are you just an attendee?
This year, I think I'm speaking on wealth creation as part of the Cumberland Initiative. The Cumberland Initiative is a movement of academics, clinicians, and industrial people to look at the delivery side of healthcare, and in particular to try and look at the knowledge economy around that. So how can we make more of what we know? How can we use what we know to organize the delivery of care better, to have fewer people ejected at the wrong stage, fewer people waiting at the wrong stages, that kind of thing. So how do we organize the delivery of resources to people at the right time? How do we coordinate? How do we really run the choreography of care? And two of the areas that we're really interested in are the use of simulation and modeling for planning ahead, and also the use of information systems, knowledge infrastructure, that kind of thing, for managing the knowledge that we have.
What are you aware about the new themes and ideas being explored at the conference this year?
The slot that I'm in is looking at the question of sort of poverty and health, and that's why I think employment is such an important theme that sort of dovetails with my interests and dovetails with the interests of HC. The thing that impressed me, was it last year or the year before, I can't remember, was the way that it looks after the health informatics community and creates some career progression. So there's, it's not directly aligned with the sort of the day job, but even in its management of its membership, it's quite conscious about the link between having some skills and having a career path and managing that career path appropriately.
It's been kind of said that the conference is gaining more international feel. How do you interpret that? I
mean, certainly it attracts international companies. That's pretty obvious. And there's probably, I'm guessing here really, but I would think that there's probably more people from the States coming over. I think the connections with HIMSS and groups like that are very, very positive in terms of building the brand and stuff like that.
What are your own anticipated highlights for this year's event?
I like them because they give me a chance to meet people, and there's some interesting people there to meet. I think it's interesting to see what's going on in terms of what companies are bringing to market, and I've met some interesting companies through events like these. So for me, it's a chance to meet people and to see what's going on.
I understand that you have quite a range of partners collaborating on conference content this year.
I'm not here as part of a partnership. Last year, we under the program, we ran the public interest forum of the Match program. So that was a partnership program. There were four universities. We're just coming to the end of a 10-year research collaboration between the four universities. The program, I don't know, in all, it's a 12-13 million pound program, so a very significant program, and we ran our public interest forum as part of HC last year, and that worked very well. We were able to attract people whom we wouldn't necessarily have attracted before, so it does fulfill that role. This year, I'm just pitching up and hoping to have some fun.